Hi, Dr. Scott Hayden at Austin Plastic Surgery Institute, and talking about one of the newest things right now. It's called Preservé. So, the thing that makes it different than just what I will say is traditional breast augmentation is it can be done through a 1 inch incision, doesn't require general anesthesia, recovery time is markedly less, and basically you're able to preserve almost the entire breast and tissue itself. So the way that this works, incision is made, a channel separator is placed so above the muscle, but underneath the whole breast gland itself, so nothing's being disrupted. Then I can use the balloon dilator, and basically I can stretch that out so that those circummammary ligaments are all left intact. They're just pushed to the side. And then once I have done that and I take the balloon down, then I can place the implant through the funnel. These are the things that people are typically asking about. They want a quick recovery. They don't necessarily want general anesthesia. They don't want the entire breast gland to be disrupted. They're looking for that sort of smaller, perkier look, very active lifestyle, someone that works out a lot. And in addition, they don't want the chest muscle to be disrupted. In other words, they want to be above the muscle, so it makes it easier. So with Preservé in particular, the implant is placed above the muscle but beneath the entire gland. So none of the breast itself is disrupted. So when you look at this from the side, these are what are referred to as the circummammary ligaments. This is sort of the nesting portion where the implant sits, and that's the strength. The implant is here, and then the breast gland itself is above it. And this is my artistic drawing over a bird's nest. And so I think the bird's nest is very helpful in the description because, again, this nesting effect is the circummammary ligaments that are here. So when the balloon is placed, those ligaments are then stretched apart. Once they're stretched apart, this can come out, and then the blue represents the implant itself. So when we're using implants in the Preservé, they're almost always significantly smaller than when we use traditional implants. And the reason is because what we're trying to do is we figure out where on the breast we want that implant to sit. And instead of having to span the entire width of the breast and the entire height of the breast, we're leaving all of this breast tissue and or circummammary ligaments intact here, and then placing that implant above it so we can use a little bit smaller implant. The nice thing about that is that it doesn't stress the breast as much, and so long term, you don't have the same problems as the breast being basically burdened by a very heavy implant. Here are two implants that would be examples of what we would use in the Preservé. This is a 170cc mini. This is a 250 15cc demi. And so you can see one just gives a little bit more roundness and projection than the other, but they're both very stretchable and can go through that very small opening. So again, the things that differentiate Preservé from other traditional breast augmentation techniques is that we can do it through a very small incision. We can place the implant exactly where we want it, and it doesn't have to be done with general anesthesia. The recovery is significantly less and complications are minimal. So I think for a lot of people, the Preservé is probably the best technique that's out there. So if this is something that you're interested in, give us a call and we can talk to you specifically about your desires.